So, hi, Dr. Janardhan. Thank you for coming on to the first episode of the podcast in the future. So, today uh, we're going to talk about what you do and what your experience is in the medical field. So, firstly, can you just introduce yourself for the audience on what you currently do and how you've gotten to become the co founder of Insera Therapeutics?
Yeah, hi, Krish. Thanks for this opportunity. I'm very excited to be part of this podcast. So proud of you in putting together a series of great conversations for people to learn from. My name is Vallabh Janardhan. I'm a physician by training, and I'm the co-founder of Insera Therapeutics, a medical device company that's making life-saving medical devices. So very excited to be here to share my journey, as well as have a conversation on some of the key aspects of healthcare.
You so Um, for my first question that I had, so did you always know that you wanted to be a doctor, wanted to like solve or minimize the impacts of blood vessel blockages that happen to blood clots? These off, as you know, these often cause like lung clots, leg clots, strokes, and other vascular diseases. Because a lot of people I see like nowadays don't really know what they want to do. So how did you figure out that this is what you wanted to
It's a great question. As someone in the field of medicine, it's always fascinating to ask this question: How did I choose this field, and then how did I choose the specialization, and how did I end up in the medical innovation side of things? So it's very important for young kids to know how different people make life choices, and then they can make a thoughtful, informed decision. So I would group this into three categories. The first one was when I was in school. Um, just like you, I loved sports, and I enjoyed playing with my friends. And I always wanted to be an astronaut to kind of go to outer space and explore things. But it just so happened that health illness impacted me. There was a lot of infectious disease. One person in a classroom gets it, everybody gets it,
do?
and I realized that there were several diseases, including infectious disease as well as blood clots in people that did not have cures or treatments that at that time could save lives. So I was very fascinated by the ability to understand this disease and be able to prevent it or treat it effectively. So I switched from outer space to inner space, and that's how
Mm-hmm.
in high school I wanted to be a doctor, and that was the initial light bulb that went off in my head. So I think it's important for you as a high school student, as well as your colleagues, to look at what is truly passionate for you, because that's the energy that will get you through these very exciting fields that exist. The second area was uh, when I was in med school. I wanted to study the blood vessels because I realized that if these blood vessels get blocked in the brain, they cause brain attacks or strokes. When
Mm-hmm.
they get blocked in the heart, they cause heart attacks. When they get blocked in the lungs, they call pulmonary embolism. When they're blocked in the leg veins, they call deep vein thrombosis. And deep vein thrombosis occurs in people who take long flights and they don't move their legs. That's why the air hostesses tell you to move your legs and walk in the flight and long flights. When these clots happen in the arteries of the legs, it's called limb ischemia. When they happen in
Mm-hmm.
people with kidney disease who have an arteriovenous graft in the forearm to help with dialysis, it's called clogged hemodialysis grafts. And so, depending on where these blood clots occur, they can cause a pretty severe life threatening condition. So, I was very fascinated about wanting to tackle these, but I had no idea how to tackle these in med school. And later on, I realized that there was this new techniques of using tiny catheters or tubes to approach these locations through a keyhole with no incision so that we could tackle these life-threatening conditions through tiny devices going through keyholes. And that's what got me excited in this whole field of endovascular
Oh, okay.
surgery or
Mm-hmm.
interventions. And then the last one I would say is how did I get involved in medical device innovation? So I lost three grandparents to stroke, and I lost an aunt to a lung clot called a pulmonary embolism. So it's a personal fight for me to be able to make an impact on blood clots all over the body. And in that process, I realized that life is like a beautiful puzzle that comes together, and I got trained with one of the best and brightest in the field, and he was a medical device innovator, and it so happened that I spent a significant time understanding biomaterials and medical devices and how they go through the regulatory processes to get approved, and so that kind of spurred the innovation part in me. I also moved from Harvard and Cornell Columbia, where I trained, to the Twin Cities in Minneapolis, which is again a big medical device
Mm-hmm.
innovation hub. And some of the patients that I treated were interviewed, and it showed up as a sequel in the news, linked to the Grey's Anatomy show. So I started getting to know all the medical device community because of the devices I was using and saving lives. And so I feel like life is a beautiful process where you kind of have different time points where you have to make career choices, and as long as you're passionate about that choice, it will lead you to the final destination. So that's how from outer space, I moved to inner space. From inner space, I moved to wanting to make an impact on blood clots through endovascular interventions, through keyhole surgery. And then I actually got to work and meet with the right kind of people to be able to create these kind of devices.
I really like that analogy you used about life because I think it's really amazing that you've like found your inspiration and passion and are able to work towards that. So then a question to kind of like expand on that is how do you think that high school students right now can find their passions if they don't know like what they wanted to do? Because recently I didn't really like know what I wanted to do or where I wanted to go, and we have all these outside influences like our parents telling us what to do, but like oftentimes we don't actually want to do those things and we get pressured into them. How do you think we can like actually find our passions and see what we want to do with our lives?
It's a wonderful question. I think you should listen to parents, whatever input they give, because they
Mm-hmm.
share it with the best interests. But you should also do your own research and understand what is it that you truly want to do from inside. And there's a famous a Japanese concept called finding your ikigai. And what that is if you can kind of find something that you're passionate about to make a difference in this world, and then your actual work doesn't look like work. It's a fun journey because you're doing what you love, and if it's going to help someone more than yourself, then that's even better because now you're helping others in the process. And the third one is if it can pay and support you, then it's even better because then you have a trifecta where you've got a job, you've got a purpose in life because you're helping people more than yourself, and you're also doing what you love, so it doesn't feel like a job at all. You're just having fun. So finding your ikigai is very important, and so life throws different events and circumstances. You just have to be open to listen to them. Like I listened to some of those experiences and events that happen in my life, and they change your direction, and they will eventually lead you to finding your ikigai.
Yes, I think it's like extremely important to just see where like life takes you because oftentimes people think that they're like trying to get to somewhere else, but whatever life throws at you, that's what was like meant to be. That's what I have the thought process of. That it's really important to do that because then you can accept where you are and like find where you can best help right now. But back to you then on the next question, where you and your co-founder have developed a kind of a sophisticated vacuum cleaner to remove blood clots and blockages in the blood vessels, which is much easier than like traditional how doctors traditionally do it right now. So where did you kind of get the idea for this, or what inspired you? And then how does this work for like the people in the audience that don't really know much about it?
Yeah, it's a great question. I'll try to simplify it. So currently, when you have blockages in blood vessels going to the brain or the lungs or the legs, traditionally we've used blood thinners to go and open up these blockages. And the challenges with that is those blood thinners can circulate in other parts of the body and can increase bleeding risk, especially if the patient has a risk of falls. And
Mm-hmm.
more elderly people have risk of falls, so
Yeah.
they are not safe to be on a lot of these blood thinners, either for a short period of time or a long period of time. So then the next question comes is, can we go in minimally invasively, which means through a keyhole, and be able to remove these blood clots so that you don't have the risk of all of that bleeding? So then came the whole host of endovascular devices to go through a tiny catheter or a plastic tube to the location of the blood clot and try to remove it. So one of the initial steps over there was, can you actually use like a syringe to manually aspirate the blood clot? The advantage of it is it's simple, but the disadvantage is there's only so much you can suck in the
Mm-hmm.
syringe, beyond
Yeah.
which you lose suction power. And there are studies to show that you can fragment clots and release clots because you're not able to have sustained suction. There's also a lot of blood loss that can happen. Second one is, there are vacuum pumps that can remove these blood clots in with uniform suction or a constant intensity of negative suction. And they are a step forward, but again, the challenges are that the amount of suction in these blood vessels may be out of proportion to the blood vessels, and there can also be a lot of blood loss, requiring blood transfusions and ICU stay in the hospital. What we have developed is a sophisticated vacuum cleaner that uses a pulsatile cyclical vacuum aspiration technique, for which we have 74 awarded patents so far. And what it does is it removes the blood clot, but it also minimizes the blood loss that is able to during that process. So as a consequence, it's got both. It tends to be safe and effective, and this is something that we have shown in preclinical models as
Mm-hmm.
well as in a clinical study in Europe. Now, this device is not approved in the United States, and so it's still in the process. So I want to put that caveat, but the technology has been tested in multiple independent labs, and it's in an exciting phase. Now, how did we stumble upon this innovation of a next generation vacuum aspiration to remove these blood clots within a few minutes? Is a very interesting story. I was, doing these procedures, and I was on call at nights, and we used to do these 36-hour
Mm-hmm.
shifts. We are,
Yeah.
covering the hospital and emergencies. And one of those nights, I had gone out for dinner, and I had coconut water, and I was using a straw, and and I realized that the kernel in the coconut water got stuck in the straw, and so I couldn't enjoy the coconut water when I was having dinner. So I should have just thrown that straw, but then I decided to suck on the straw like uniform suction
Mm-hmm.
would do, and I found that that kernel got compacted like a bullet in the straw, and it's translucent, so you can see through the
Yeah.
straw what is happening. And then again, I should have just thrown straw and taken another straw, but I never go the easy route. And that's a lesson for everyone is never take the easy path. When you just keep probing a question of an observation that you see, you will stumble upon some very interesting solutions. So then I said, instead of using uniform suction, what if I pulsate this suction with my cheeks going in and out and see whether this kernel comes out? And when I did that, I was able to see that the kernel came out, and I enjoyed my coconut water. So um, so I went out of the restaurant, told my co-founder that I had this aha moment. And he said, just finish dinner and go sleep. You're just overworked, and you're not thinking straight.
Yeah.
And then, I just left it at that. And then a few weeks later, he was out with his kids, having having a meal, and the kids were having like milkshake or some popsicles, and they were milking they were pulsating their cheeks in a way to pulsate that straw to avoid those icicles, popsicles to get stuck in the straw, and they were enjoying their milkshake. So he
Mhm.
came running out of the restaurant saying, "Remember that that uh, observation you had a few weeks ago, it's actually real." So that's how the genesis of all of this started. And then we went through years and years of testing and understanding the mechanism of this, and finally came to this wonderful moment where we've got all these patents and all of this research that has been published, and it's on the path to be able to make an impact in the field. So it was just a simple observation, but I guess I had to study for 15 plus years to understand the viscoelastic properties of blood clots and
Mhm.
fluid dynamics and all of that before I could actually understand what was going on with the straw and the coconut kernel. So there's this famous saying, "The eyes do not see what the brain does not know." So the more
Yeah.
you study and the more you educate yourself, the more observations you will make.
I think that's like really amazing that from like random observations of everyday life, we can like create whole new methods of like actually taking out blood clots or any like new inventions that can happen. And I think that's really amazing that like we can just save human lives just off of like seeing that a kernel gets stuck in a straw, or like popsicles being or icicles being stuck in a milkshake or things like that. That it's really interesting to me that that's happened, and we can like see that historically too, where like random observations lead to like new inventions that will like always progress human life. It's incredibly interesting to me. Um,
Yeah, so
yes.
true.
Um,
So
s- yes, go ahead.
no, I just
You have
said
to
it's so true. And the only thing I would tell young kids and students is, whatever you observe it fully, and and if you're not able to explain it, don't worry, it's okay. We don't need to know everything on planet Earth, but the fact that you've observed something and you don't know why such a thing is happening may be one of the best inventions that would happen in the future. So it's all about being honest to yourself, observing something to the fullest, and being very open about not able to understand why that's happening. And that may be one of the best things that could save people's lives in the future. So it's a nice anecdote and lesson for children and youngsters as they grow up and observe things in this world.
hmm That's really great advice, because I think like a lot of the times we're just rushing through our daily lives and not like focusing on what actually happens, when we can see that small observations like that can like lead to crazy things and um new innovations and all those things. But all we have to do is just stop and actually look and observe those things that we sometimes may not understand, instead of just like skipping over them, and actually slow down life to like make sure we can actually see what's happening. So then on my next question then, so what are like some potential benefits of using this technology that you've just explained that are going to be like compared to the traditional methods of removing blood clots and blockages? Like, can you give us some statistics or like experiences where you've had in the lab where it's been a lot easier to actually remove blood clots using your technology?
Yeah, we've done extensive research with third-party labs that have independently done research, and what they've found is that in terms of removing the blood clot, there's close to a 280% improvement in removing the blood clot burden when you use a pulsating cyclical vacuum instead of a uniform suction. In addition, what we've found is if you had a straw or a catheter and you had a blood clot, there was a 50% higher chance that you would have a complete ingestion or removal of that clot when you use cyclical aspiration over uniform aspiration. In addition, uh, in terms of safety, we have seen with work done at University of Massachusetts that's been published in literature that when you use cyclical aspiration, you've got an eightfold reduction in clot fragmentation compared to uniform aspiration, and a 15-fold reduction in clot fragmentation and fragments going north of the lesion compared to a clot removal device. In addition, we have noticed in lab research that we have done at top institutions that have been presented at international conferences that using pulsating cyclical vacuum is actually gentler on the vessels than using a uniform high intensity suction. And lastly, and most importantly, we've got a cyclical aspiration algorithm that significantly decreases blood loss so that you don't have to give transfusions and have the patient stay in the ICU. And so these are some of the research that's come out of uh, um, our our research that has been done so far. And it's an exciting journey where we are and where we're going to be. And so we're looking forward to this journey, and we're basing it on science, and ultimately this is going to help save lives.
Okay, so a quick, like, kind of follow-up type of question to that, because I know that, like, with any new invention, you're bound to have challenges and a lot of, like, hardships to actually work through, because obviously your prototype or your very first idea is not going to be perfect. So what are some challenges that you faced and your co-founder faced while actually creating this to help uh take out blood vessels much easier? Or
Yeah, it's a great question. I think I I don't think there's any innovation where you just stumble upon the ultimate solution on first attempt. And so you need to learn from each iteration that you do. And so it happened to us also. So when we started, we had taken a commercially available vacuum pump, and we added an external gizmo to be able to convert uniform suction into a pulsating suction. And what we noticed is that there was a lot of dampening effect in the catheter, in the length of the catheter. So by the time it came to the tip of the catheter, it was more like a flat wave rather than a pulsation or a cyclical vacuum. So we actually had to completely redo the vacuum source with like a motherboard, like a conductor of a orchestra, and so it was able to generate these pulsating cyclical modulated suction algorithms that that are able to transmit all the way through the end piece, which is the catheter or the plastic tube that goes from the vacuum source to the patient's blood clot. That was one challenge that we overcame. The second challenge that we overcame was there are different types of blood clots. They can be softer blood clots that have more red blood cells in it, and there can be more firmer blood clots that have more fibrin in it. And so there is a spectrum of these blood clots, and you can't use a one size fits all for all of these blood clots. So what we found is there are actually digital thumbprints or for each of these types of clots and what type of cyclical algorithm you need to be able to remove it. And we were able to come up with the middle of the bell curve that would be able to tackle most of these blood clots so that we provide a simplified button for the physicians to use, and then two standard deviations away for the more adherent clots to be able to remove that. So we learned through this testing and years of research that we have found those digital footprints for different clot types, soft clots, hard clots, firm clots, and we've been able to harmonize that and study the different harmonics of these cyclical waveforms and be able to have these fused algorithms all within the safe suction range of 0 to negative 29 inches of mercury. So it's safe, but it is optimized for the location of the clot, the length of the clot, and the morphology of the clot. So we're able to do that. So that was another learning for us. And we gave up on a lot of techniques that didn't address the viscoelastic properties of a blood clot. And so that's another thing. The third one that we found was blood clots are elastic. So you must have seen a rubber band.
Mm-hmm.
So,
Yeah.
so if you stretch the rubber band, it's going to come back,
Yeah.
right? And that's called the elastic limit.
Yeah.
And then if you had a little older rubber band and you stretched it, it might stretch, but it may get deformed.
Mm-hmm.
That's in the plastic zone. But if I gave it to my 8-year-old kid and asked him to play with the rubber band, he might just pull it and snap the rubber band where it goes beyond the breaking point.
Mm-hmm.
So blood clots are similar to that. So if you use a technology to be able to remove these clots, but you use brute force, it's going to stretch it and break it. So you have to go multiple times to pull out these blood clots. But because we have programmed our cyclical algorithms within this safe suction zone and within the elastic plastic limits below the breaking point,
Mm-hmm.
we're able to remove these blood clots more and have lesser clot fragmentation. So that was the third lesson. So these are observations that we had during the process, and if you're honest with your team and you put your minds together and you get the best minds together, you can solve these challenges. So it's an exciting journey. I think it's fun to come up with obstacles and bring the right minds together to overcome it. And what comes at the end of it is something we can all be proud of in the future to be able to help people.
I think it's like extremely important to work through these challenges then and not give up, because if you would have given up through these challenges, then we would have never had your invention to be able to like help able to like pull blood clots out more easier. So then and all the inventions that people have created like wouldn't have happened if they just given up in face of these challenges. So it's incredibly important to do that. But on the next question then, so for me, my passion is like wanting to actually like help change the medical field specifically through like AI and create AI programs that will help like detect maybe cancers in patients or recursions. So then in addition to just like medical devices, have you seen the impact of artificial intelligence or machine learning in the medical field like throughout your entire time being in here?
Yeah, I think I'll give a short example in our current journey, and then I'll give you broader examples in the field of medicine.
Mm-hmm.
So it kind of opens your eyes and the audience who listens to it. So I was just talking to you about these digital footprints for different clots.
Yes.
So that's the kind of thing that could go into a machine learning algorithm, wherein we have studied certain types of blood clots, and there's a certain types of cyclical algorithm that's associated with it. Let's just keep it simple, like for soft clots and for firm or hard clots, there are these digital footprint signatures. And so those things can kind of be part of machine learning as things are being used, so that we can kind of remove the right type of blood clots in the future. To keep it simple, we've kind of harmonized it into a couple of cyclical algorithms, but there are innumerable that can be created for in the future within the safe limits to be able to customize it for different types of lesions. Another example of machine learning is, if you look at the field of wearable technologies, right? So you can collect your heart rate, your blood pressure,
Mm-hmm.
and different metrics can be collected. These can kind of be then looked at to predict disease. And that large amount of data can be fed in, and machine learning algorithms can work on it to detect different types of disease, and then you can, sort of have a pre a little advance notice about what's going to come, and hopefully have some time to act. Another example could be wherein there are these imaging studies that are done um, to be able to, whether it's ultrasound or CAT scans or MRIs.
Mm-hmm.
Examples could be with breast cancer or prostate cancer, and and so if you use the human eye to look at it, there are certain black, white, gray zones in these images that you look at, and a trained eye can actually pick that up. But if you were to look at the volume of these studies that are being done worldwide, if you had a machine learning algorithm and artificial intelligence based system that could detect some of the nuances in the gray zone and help identify whether it's blood clots or potentially malignant lesions compared to benign lesions, these may make a big impact on people's lives.
Mm-hmm.
Another area of artificial intelligence and machine learning is, a lot of people have biopsies and pathology slides and stuff. Now, can those be correlated with with the imaging studies and disease? And this is called digital pathology, and this can be used to be able to make a big impact in patients' lives. So it's an intersection of computer science, engineering, medicine, predictive analytics, so that you can actually make an impact, and you can approach it from any of those fields.
Yes, we can see like already a lot of benefits, like what you were just listing through examples of how it's already impact the medical field. But also, for this next question, I only ask this because a lot of people think that AI might take over the world because like it's going to become too big or autonomous or things like that. So, what do you think are some of the big issues or limitations with AI? Or will this actually happen with AI? What people are like speculating?
Yeah, I think when we think of artificial intelligence, um, I think we think of an independent robot that can take over human decision
Mm-hmm.
making, and completely make us all irrelevant. And maybe they go rogue, and we can't control these entities. So, but I don't think that's what it is. So the way to understand what artificial intelligence currently is and what the human mind currently is, let me take a step back and share, how do we define the human mind. So the reason why human beings are the most advanced creation on planet Earth is because our human mind has three functions. It's got an ability to generate thoughts, and these are ideas, new innovative ideas, new treatment paradigms. So this is thoughts.
Mm-hmm.
The second one is mood. So these are emotions. They can be elated emotion, or they can be a lower emotion. So there's an emotional aspect to it, emotive aspect to it. And then the third aspect is, so the emotive aspect is when a doctor talks to a family that has a family member with a life-threatening condition. There's a certain empathy that you talk to the patient
Yeah.
and the family on how you break the news, how you share the treatment options. So that requires empathy, and there's emotions involved in it. So that's mood. And the third aspect is intellect. And intellect is memory, it is large amounts of information, ability to retrieve them from short term memory or long term memory. And the brain does all of these three things: thought, mood, and intellect. Now, machine learning and artificial intelligence, as we see it today, only focuses on the memory intellect part where there's large amounts of information fed, and then you're using it to kind of come up with analytics and decision making. But artificial intelligence is not generating new thoughts and new procedures and new inventions uh, that only human beings can do. And artificial intelligence is not empathetic enough to talk to patients or families to give them the news about a complex medical condition and handle the emotions of a patient or a caregiver. So I want to kind of put this in perspective that the human mind is way more advanced, and I think AI has significantly advanced, but it is focused currently predominantly on the memory, intellect, big data part of it. But it is not focusing on the thoughts and mood. So there's no risk of this becoming something that is an independent robot that can outsmart the human mind in thought, mood, and intellect. So it may happen later, but as it is stands today, it is a complementary tool that can help us. And we have to obviously regulate it and use it where it complements the human intellect, so that some of the large computations can be done by AI and artificial intelligence and machine learning. But I don't think there's any doubt about thoughts and mode and stuff. So I just wanted to put that in perspective, so our audience just has a understanding of where we are.
Yes, I think that's like a common misconception that a lot of people have in today's society, and and then that type of misconception, it's not only like in a thought or an idea, but also could like lead to like less innovation by not using AI because of these ideas. So I think it leads to like these harms that are not like needed because of this misconception. So it's really important to clear that up then. For my last question, just to close this podcast, then, is what advice would you give to like aspiring medical innovators who are like interested in developing new technologies for healthcare or want to join this field just like yourself?
I think it's a great question. What I would say is, with regards to healthcare and medical device innovation and healthcare in general, um, I think it is the future. The COVID pandemic has taught us that health is wealth. So everybody realizes how important health is, and so the field of healthcare is going to be there as long as human beings are there. And so it is a wonderful field for any youngster to want to get in. And within the field of medicine, there are close to hundreds of fields, subfields that you can go into depending on how much patient care you want to be involved with, how much technology you want to be involved with, how much the empathetic side of healthcare you want to be involved with. So, and based on the age group of people you want to be taking care of. So, based on all of this, you can choose the type of field within medicine that you want. But outside of medicine, within healthcare, there are other areas where you can make tremendous contributions. And one example is artificial intelligence and machine learning. And you can come through it from an engineering standpoint or a computer science standpoint. There's also an ability to be part of healthcare IT, wherein you can help generate new software apps that may be able to help with medical devices or with monitoring devices and diagnostic devices. There's also healthcare administration, wherein you can be involved in the delivery of care, but you are at the hospital acute care facility level or at ambulatory surgical center level, where you can kind of make an impact on creating that environment for healthcare to be delivered. You can also be involved in the pharmaceutical side, where there's a lot of innovation. You can also be involved in the medical device innovation side, and you can come into it from either a mechanical engineering standpoint or a electrical engineering standpoint or a medical a professional standpoint. So there's different ways in which you can enter medical device innovation. And then there's patent law, intellectual property law, wherein you can have both a healthcare, like a science or a medical degree associated with a JD legal degree, and you put those skills together to be able to help shape new innovations that are coming out with intellectual property protection. And there are areas of so these are just different, some of the different areas of healthcare that I just wanted to expand the horizons of your mind and the youngsters who may be listening to this, or parents of youngsters who may be listening to this, that there are different aspects of healthcare that that youngsters can grow into and be involved with. It doesn't always have to be a clinical medical career, but if that's what you're passionate about, that's what you should go after, and that will lead you to areas of innovation that you can help out with, because as a doctor, you see a lot of the unmet need that needs to be solved, and so you can identify that, and if you partner with the right engineering team and the right business teams, you can make that idea into a technology that can help, and then you can help take that to the right people who can help commercialize that technology so it benefits people in the United States and across the world.
Okay. Yeah. So to my understanding, basically the advice that you want to give is that there's like many different fields in the medical industry, and it's not just being a physician or like actually being a doctor, but actually there's so many different fields. But it's just important to find like what you're passionate about specifically in those fields, because it's at the end of the day, I think that it's like very important just to see like what do you want to do, because that's where you'll find passion and joy in your job then. Okay?
Absolutely.
Yes.
You summarized it beautifully.
Okay, thank you. So that's really all I had today for you. Thank you so much for coming on the first episode of the podcast of the future, and I got to learn a lot more about what you do and about the medical field. I'm sure anyone listening to this will value this information, and just thank you so much in general for giving me this opportunity to interview you.
Yeah, the pleasure is mine. Thank you again.
Thank you.